master's was in breast cancer research, right? So I was just wondering, how did you pick emergency medicine as your specialty?
Yeah, so I kind of knew I like immerse since undergrad, because of my personality. Like I first of all, I was in martial arts, and I'm also like very much like a type A, like probably undiagnosed like ADHD, like very like on the go. So I feel like Emerge always like fit with my personality. So I somehow always liked Emerge, even though I didn't really know what Emerge was before med school. And when I was applying for my master's, and the reason I decided to do a master's was to obviously like make myself more competitive, but also because I wanted to, I didn't want to apply right after undergrad, and I just needed some time. So I applied to different labs actually. Like I applied to a bunch of different ones, and then I chose the breast cancer one because I always found cancer pretty cool. I thought it was like a own whole world. It was a wet lab, and I had like never done wet lab before, and I thought I would like it, and I actually liked it. And I also really liked the supervisor, so I met with him. It was a women's college at U of D, and I really liked them. So for those reasons, I decided to do it. I also got into, I think it was like experimental medicine at McGill, and epidemiology at York. Actually, I forgot her name. She's an epi prof with at York for the kin program. Anyways, I also applied to her lab and I got in. So I had a few options, and I just really liked the downtown program. And then once I finished my master's, I realized that like a specific type of, like, for example, I was like breast cancer genetics in a specific population. Like it was too specific for me, and I like to know a little bit of everything. So I decided I actually want to be a generalist. So Emerge is like a very, very general specialty. So that's why.
Um, if you don't mind me asking, what specifically in breast cancer did you examine or did you look at for your master's?
Yeah. So I was actually in a lab that was trying to find a new breast cancer genes. So I don't know if you guys know any of them, but like BRCA1 and 2 are like a very high penetrant breast cancer genes that, like, if people have those mutations, it puts them at a very high risk of having breast cancer. But obviously, not all patients that have breast cancer have BRCA mutations. So our lab was actually focused on like finding new breast cancer genes. So that was very cool. Very like tedious work, but I focused on a founder population, which was the Bahamas, who had very high rates of breast cancer, but not BRCA mutations. So we kind of used, it was like a case control study. So a bunch of people who had cancer from that population, and then a bunch of people who didn't have cancer, and then did like a genetic analysis to see if the ones that had cancer had a higher rate of mutation of a specific gene. It's actually still ongoing. So I graduated 5 years ago, and like I think someone's still trying to validate the research. So like very tedious work. So
Oh, that sounds super cool. That sounds very cool.
Yeah.
I have a question.
Yeah.
If you could go back in time and change anything that you did during your undergrad or your master's, what would it be? Or if not, what was like an obstacle that you came across during your undergrad or your master's?
Like specifically for getting into med school, or like in general?
Like just in general, like or specifically, it doesn't really matter.
Well, I think I took things like very hard. For example, like I did an extra year to raise my grades, and like, should I have planned it a bit better? It didn't really matter at the end, because Queens only asked for like your last 2 years. My last 2 years, like third and fourth year, my GPA was fully fine. So I actually wish I didn't spend the extra year. It was kind of useless. And then also, I wish I didn't take things as hard. Like I think a lot of times I did things just for the purposes of like trying to get into med school, and like trying to like, and that's totally fair. And I think we all have to do a bit of that if we want to get in. But I do wish I like stuck to my passions a bit more, because like I did karate my whole life, and what came up at my interviews was not like this research that I did or the hospital volunteering, what came up was like the 20 years of karate that I did, right? Because that's what really makes you stand out. So if you guys have a passion like playing the piano or art or anything that makes you human, that would probably go a longer way than picking up like your fourth like undergrad lab. That's probably not gonna like get you even published, you know? So that would be my like feedback, because I think I did a lot of extra work that I didn't need to do. Yeah, it goes without saying that like your GPA needs to be high and your MCAT needs to be amazing. So like those aren't things that you can cheat, like, but those are just the step for you to even like get your application viewed, right? And then once they get your application viewed, then it's all about like who you are as a person.
Yeah, because that's nice to know, because I have a lot of friends who beat themselves up over really small things and stuff. So it's nice to tell them that people have gone through it and it's not that serious. So thank you.
Yeah, exactly. So if you have like a passion or things like that, I would stick to them. I think medicine or med school and specifically, or like people in medicine, they like to see people who are committed to things on a like a long-term basis. So I think it also shows that you're like a human and have like a life outside of business. I think there was some questions in the chat too, like who was the prof that I worked for in my master's, I think you meant. It was Dr. Akbari. And if you guys go to like any of the faculties at UFD or York and then go under faculty, you'll see like a list of people who are accepting students. So it was Dr. Akbari. Can I ask what was your GPA? My GPA in first year, I never got like, my first year was like a lot of B's, but like that's not good enough for med school, frankly. And then when I decided I want to go, I actually like put everything into it and like studied really hard. So I think my last 2 or 3 years was like 3.98 or something like that. Yeah, like only like A pluses and I think like 1A potentially. I don't know if you guys are like in the process of applying, but I would like, there's something called OMSATs, if I think that's what's still used. It has information about every school and like what they require. So I think that's like a good like making an Excel sheet of like all the schools and like what GPA they want, like what MCAT they want, and then seeing like what you're working for is really helpful, right? Like when I decided I want to go to med school, it was like 3rd year undergrad and my GPA wasn't even good enough to go to the Caribbean. So like, you know, knowing that and saying, okay, that's fine, but like I'm gonna try to like get myself better to go to the States. And then it was like, okay, but I'm actually gonna try to get myself better to get into Canada, and like just working my way up like that and having a goal, right? And also knowing like what each school is looking for would be helpful.
So I know that you were on the committee for, I believe, Queens. If I'm not mistaken, what were you looking for in a candidate to even to give them a chance to interview, basically?
Yeah. I obviously can't talk about specifics because like we obviously all sign like a confidentiality. But yeah, I was on the admissions committee, and like first of all, again, like your grade and MCAT is like 10 out of 10 was going to even get you to get, like, if you don't have the good grades and you don't have the high, like no one's going to review your application. So that's already like just the one thing. And then Queen specifically is like a very extracurricular heavy school. So they like look at your ABS, it's called, like very closely. And again, like I said, it's just like looking to see if you are like a well-rounded person, at least for Queens. Like they really care about like extracurriculars, they care about like long-term commitments, like if you're a team player, if you were involved in like things outside of school, and also like, you know, obviously research. Like I think if you guys have like publications or like poster presentations or like conference presentations, those are all like very helpful. But more so I think they looked at like if you were involved in a team, like just like getting to know you outside of, like if someone was like, I ran like 4 clubs in school, like that's great, but it's like, well, what did you do outside of school, right? So I think more so about like a well-rounded person is what Queens was looking for. I think there are schools that don't even look at your ABS, right? Like I don't think McMaster even looks at your ABS, if I'm not wrong. I think they look at Casper, your grade, and then your MCAT. Yeah, so McMaster doesn't even care. So. Why not use your master's GPA? Your master's GPA does not count. They care about your undergrad. It might add a point or two for some schools, but like they don't care what you got in your master's because usually most people get really good grades in the master's because classes you take in master's are not important. But the classes you take in undergrad are very fun. Any other specialties that intrigue you? Yeah, I liked a bit of everything, which I think is why I like them, right? So I actually really liked, I considered like family medicine. I considered gen surg for a bit and anesthesia. It's like a bit of everything, to be honest. But I think like in first or second year, I was like pretty sure I want to do emerge, and yeah, I'm like almost a year in, and I really like it.
Do you see a lot of, you know, disease that like basically skin helps you narrow down what it could be, and kind of put the pieces together?
Yeah, for sure. Again, just like those. So skin is like a part of physical exam, which is the first thing you do when you see a patient after taking their history. So I'd say it's like very, very important. I actually, with that patient that I just presented, had the Janeway lesions and Osler's nose, and that was like one of the things that like tipped us over to with having like a heart murmur is like, oh shit, they have like endocarditis, or some skin diagnoses are like specific to obviously derm conditions, but yeah, I would say it's like very important and something that you guys shouldn't take lightly. How do you find being on call at the ER? We don't do call in the emerge, we just do like 8-hour shifts. It's tiring for sure, doing like different shifts at like different times of day and like your schedule not matching your friend's schedule. But I would say that I like it. And emerge, you only work like as a resident, you work 15 to 16 shifts a month, but as a full-time staff, you work 12. So you actually have like the rest of the month free, which is kind of nice. GPA. I think that's a really good GPA for sure. It really depends on what school you're applying to, because some schools have a cutoff and they don't really care what your GPA is after the cutoff. And some schools have a competitive GPA. So like, I don't know, I applied to med school like 6 years ago now, so things may have changed for some schools. I think even like Queens has changed from the time I applied, but I would look at their cutoff and then I would look at and see if they look at the marks competitively. So for example, I know McMaster looks at grades competitively, so I would say like a 3.88 is probably not good enough. And like even Ottawa, I think for Ottawa, my like GPA at the time was like 3.94 when I applied, and that wasn't even good enough. So again, maybe things have changed, so I would really go on the OMSAS website and like try to see what they want now. But I think that's a very good GPA, and I think it would, if you have a high MCAT, like that would put you in a good position for some schools. But you just have to go on OMSAS and like see what they look for. Should you consider applying internationally? Yeah, I considered applying internationally. Actually, my family was like encouraging me to just apply to like the Caribbean or something when I decided I wanted to go, because like obviously it's a very long path and a lot of times you might get very tired of along the way and not want to do it anymore. But I, in a way, knew I can do better, and like I knew I can like study more and like raise my grades and like do an extracurricular and like, you know, get myself like more competitive. I only applied once. I think, yeah, I only applied once, but I wanted to apply when I was ready. So that was like on my first year master's. And then I decided if I don't get in after that 1 year, because I was already also like I was like around 23. Um, I decided that if I don't get in, that I would apply to the States. So yes, I did think about applying internationally. I gotta say though, coming back to Canada is a lot harder once you're international, unless you want to do family medicine. So matching to family medicine is easy. Matching to something competitive like a merge or surgery, if you are international, is not undoable, but it's very, very, very hard because there's only a couple of spots in the whole country, and people from all over the world are applying for them. So I was like, I would have rather worked hard to get into med school and then know that I will like get to do the specialty that I want after in Canada than to like get into an easier med school, but then have a really hard time. So that's really a personal choice.
Have you found that if you're applying for, let's say, US, do you have the same chance of getting into the residency you want in US if you're an international student?
I think so. I think the States has a lot. Canada has like 14 med schools, like 4 of which are French speaking. So like really like 10 or 9 med schools. Like the States has like 200 med schools and like just as many residency programs. So I think in the States it's much easier to match because there's so many more schools. Not all of them are great, but like all of them will make you a doctor. So it doesn't really matter what you do. Even DO was like a really good I was looking at. I was thinking about it. I think that you should, yeah. I think that like I have friends who ended up going to the States who stayed there for residency and like they're in good residency. So yeah, as long as you don't care about like going to Harvard or something, then I think you'll have a good shot of matching into a States residency. Yeah. It's very expensive. Study there also.
It is very expensive. I just wanted to ask you one more question. Do you think that the lack of many medical schools in Canada is also contributing to longer wait times in ERs, for example, or for simple procedures, people have to wait like 6 months or more?
Because of lack of med schools?
Yeah, like you basically have less doctors.
Oh yeah, for sure. There's definitely a shortage of doctors, shortage of like residency spots. Yeah, that's not for sure. That's like a whole systemic issue.
How does that affect like the day-to-day in emergency room, for example?
That's a very big question. I don't know if lack of med school is the right thing. It's really lack of funding at a systemic level, like at like a very higher, like governmental level, more so than lack of med schools, I would say. But yes, we need way more funding for healthcare as a whole.
I'll ask one more question, I guess. Did you feel like, it was easier going to medical school from a master's, just in a level of maturity and like the state of mind from like rather than going straight from undergrad? Like, have like knowing that you would be able to do it and being confident in your abilities.
Yeah. I personally liked it. I would say that it gave me more life experience. Like I got to travel more. I got to like I took the MCAT twice, so I had like more time to like study for the MCAT again. I got to present and like publish my research, which I'm sure helped me. And yeah, like in my master's, I was involved in like the student body. I was like involved in intramurals, so a bunch of stuff that probably helped me like build my CV, raise my MCAT score, like a bunch of stuff. So I think that it definitely helped me. If I were to go back again, like would I do it? I'm not really sure because now I'm like, I'll be done residency in like my mid 30s. I feel like my life is like kind of pushed back and like I'm like I don't want to do more extra training. So I think it was nice that it gave me a lot of life experience, but then on the other hand, like I'll be staff a lot later. So I don't know what I would choose. If I were to do it again and I knew I wanted to go to med school, I probably wouldn't have wasted time and I would have gone to med school instead of doing a master's. But like I don't really regret the things that it gave me or the life experiences that it gave me.
I'll ask one more question. No one else seems to have more questions. Do you see a lot of intravenous drug injections causing like different problems for people? And what are like the the more common disease that are like a side effect of that? If you see any, if you've seen any cases.
Yeah, I'd say like obviously like addictions, like substance use disorders, like the number one thing you see with like anyone who uses IV drugs, but bigger things are like just abscess and like infection at the site that they inject themselves. Bloodstream infections and not necessarily endocarditis, like for like bacteremia. Endocarditis is one of them. It's the biggest cause of IV drug use is the biggest cause of endocarditis, but it's not necessarily the only cause. And then obviously like it can be like laced other diseases like infectious things that they can get like hepatitis, hep B, and like HIV from using like not clean needles. Those are a few things, yeah.
No questions from anyone else? Okay. I think that should be great. Thank you so much for coming and answering all the questions. We definitely
Thanks for
got a
inviting
little,
me.
yeah,
Thank you so much
Um,
for coming.
it was so
means a
nice.
lot to all of us. We learned so much. I know
No
I have.
I'm so glad. Good luck to everyone, and thanks for inviting me.